How do we treat unexplained infertility? There really is no logical way of treating unexplained infertility, but as we have learned from experience, it's a step-by-step approach which results in the majority of patients becoming pregnant. So one of the simplest steps is giving medication to promote ovulation by producing more than one egg in a month, and by sort of boosting this process a little bit, it can increase fertility rates quite substantially. However, the majority of people who end up getting pregnant with any given treatment usually occur in the first 3 to 4 treatments. So if you're trying a treatment and you've gone past 4 or 5 cycles, it may be time to move on to the next treatment. And in this case, after we try ovulation induction with intercourse, if it is not effective, then artificial insemination is the next step. Basically, we again use ovulation induction to produce more eggs, and now we take the partner's sperm, make it go through a centrifugation process, concentrate that sperm essentially, and put it directly in the uterus. That too has a relatively high pregnancy rate. These are not incredibly expensive treatments, and in the right age groups, it can result in a 35 to 45% pregnancy rate within the 4 treatments that we mentioned earlier. Past artificial insemination and ovulation induction, if patients do not succeed, then we move on to in vitro fertilization. And in vitro fertilization, we essentially harvest eggs. Here we stimulate the ovaries a lot more than with artificial insemination. We try to maximize the amount of eggs that we can harvest. We take them into our lab. We fertilize the eggs with sperm, either by putting them together or injecting the sperm directly into the egg. We then develop the embryos, and at that point, we are able to transfer these embryos back into the uterus, either fresh or frozen. And actually, that's an entirely different topic that I will talk about later.